woman's reproductive system consists of the ovaries, fallopian tubes, uterus, and vagina. The vagina is a muscular canal that leads from the outside of the body to the uterus. The warmth and moisture of this canal creates a perfect environment for microorganisms. For example, a bacteria called lactobacilli that are naturally present within the vagina coexist with a small number of a tiny yeast fungus called Candida albicans. Normally, the lactobacilli create an acidic environment that keeps the natural yeast population in balance. However, when conditions change within the vagina that either decrease the numbers of lactobacilli or decrease the acidity, these fungi begin to multiply. The growing yeast population causes irritation in the walls of the vagina, which is accompanied by mild to severe itching. In addition, a white lumpy discharge forms that looks similar to cottage cheese and carries an unpleasant odor. Yeast infections are often caused by antibiotics that attack the natural vaginal bacteria and other factors that alter the vaginal environment, such as birth control pills, pregnancy, and clothing that is tight or damp or contains dyes or perfumes. Fortunately, over-the-counter medications are now available to treat this unpleasant condition. Sperm are male reproductive cells that are formed in the seminiferous tubules of the testes. Sperm travel through a lengthy duct system starting from the testes, through the epididymis, and then through long, narrow tubes called the left and right vas deferens. The sperm is moved past the seminal vesicles, the prostate gland, and the bulbourethral gland, mixing with fluids from each and forming the ejaculate, also called semen. During a vasectomy, the vas deferens is cut and tied off so that sperm does not mix with the ejaculate. Ejaculation still occurs normally. However, sperm is not a product of the ejaculate, so fertilization will not occur. Following a vasectomy, sperm is still produced, but it is harmlessly absorbed by your body. The uterus is a hollow, pear-shaped organ, sometimes referred to as the womb, and is part of a woman's reproductive system. The uterus provides protection, nutrition, and waste removal for a developing fetus. The term uterine cancer refers to cancers affecting the uterus, including endometrial and cervical cancer. Endometrial cancer is cancer of the endometrium, the inside lining of the uterus. The most common symptom is irregular bleeding, and diagnosis typically involves biopsy of the endometrial lining. Cervical cancer is cancer of the cervix located at the base of the uterus. Most women with this type of cancer fail to recognize symptoms until late in the disease. At that time, vaginal bleeding, especially after intercourse, pelvic pain, and vaginal discharge may be present. It is recommended that women have regular gynecological exams and pap smears, a test that identifies abnormal or cancerous cells. Your prostate is a small round gland that is located in front of the rectum at the base of your bladder. Its primary function is to release fluid into the urethra during ejaculation. Sperm travels from your testicle up and back into your body in a tube called the vas deferens. The vas deferens is behind the bladder and enters into the prostate gland. During its journey, sperm picks up seminal fluid, another component of the ejaculate, from three sources: the seminal vesicles, the prostate, and the bulbourethral glands. The sperm then travels the length of the urethra and out of your body. Prostate cancer occurs as small nodules or bumps on the surface of the prostate that can be found through rectal examination. In most cases, the prostate does not need to be removed if the nodules are detected early. If removal is necessary, the risk of erectile dysfunction increases because of the large number of nerves located near the prostate. Men over the age of 40 should have routine prostate cancer screening as part of their regular health checkup. Every month, the female body prepares itself for the possibility of conception and pregnancy by having a menstrual cycle or period. During this time, the endometrial lining of the uterus is sloughed off and replaced. This entire process is triggered by a shift in hormones that are generated by the pituitary gland, the ovaries, and the uterus. This shift in hormones can cause physical and emotional symptoms of premenstrual syndrome, which can include headaches, cramping, breast tenderness, nausea, and mood swings. Exercise, rest, stress reduction, and a healthy diet may help alleviate some PMS symptoms. During pregnancy, a woman's uterus houses and protects a developing fetus for about 38 weeks or 9 months. Inside the uterus, the baby is tethered to its mother via the umbilical cord, which is in turn attached to the uterine wall by a mass of tissue called the placenta. The placenta and umbilical cord transport oxygenated blood and nutrients from the mother to the developing fetus and return waste products into the mother's circulation for disposal. Accidents such as car wrecks or serious falls can cause the placenta to separate from the wall of the uterus, a condition known as placenta abruptio. If the separation is minor, only a small amount of blood may be lost and the pregnant woman will be treated with fluid replacement and bed rest. However, if the separation is more substantial, or if the placenta is completely disjoined from the uterus, the mother and baby may be in serious jeopardy. A large amount of darkly colored blood may indicate that an emergency delivery or C-section is required. It is also important to note that placenta abruptio may also occur spontaneously in women who had many previous deliveries or are carrying multiple fetuses. Additional risk factors may include medical conditions such as hypertension and diabetes, as well as cigarette smoking, alcohol, or drug abuse. A woman's reproductive system consists of the ovaries, fallopian tubes, uterus, and vagina. These organs are vulnerable to bacterial infections caused by poor hygiene or sexually transmitted diseases. Chlamydia and gonorrhea, for example, are caused by bacteria that enter the vaginal canal during sexual intercourse. These bacteria multiply in the warm, moist atmosphere of the vagina, causing inflammation, pain, and vaginal discharge. Left untreated, bacterial infections of the vagina can spread to other internal organs. For example, the bacteria may enter the uterus through the cervix. From this point, the bacteria have access to the fallopian tubes, where they may travel and continue to multiply, leaving scar tissue in their wake. From the fallopian tubes, the infection can also spread to the ovaries, as well as other abdominal structures such as the bladder, the intestines, and the wall of the pelvis. This generalized infection of the abdomen, called pelvic inflammatory disease, or PID, causes chronic pelvic pain, fever, chills, and nausea. However, the most dramatic consequence of chronic PID may occur during ovulation, when an egg is released from a woman's ovary. The scar tissue left by the bacterial infection may completely block the fallopian tubes, such that the egg cannot pass into the uterus. The result is either infertility because sperm cannot reach the egg, or ectopic pregnancy, in which the egg is fertilized and begins to grow within the fallopian tube. If you experience any of the symptoms of sexually transmitted diseases, or PID, seek medical attention. Early detection and treatment is key to preventing these unpleasant outcomes. A woman's reproductive system consists of the ovaries. In order to attain an erection, messages from the mind or the senses trigger the arteries of the penis to dilate. This allows an increased amount of blood to flow into 3 columns of spongy tissue in the penis. As the corpus spongiosum, which surrounds the urethra, and 2 larger columns, called the corpus cavernosa, become filled with blood, the penis grows and becomes rigid. Pressure of the engorged tissue against the penis veins and venous valve closure effectively trap blood within the penis until climax is reached or the sensation wanes. Impotence, or the inability to attain or maintain an erection, can be caused by a disruption at any point in this process. However, several types of penile implants are available that create an artificial erection. Two common types of implants are the semi-rigid malleable rod and the inflatable implant. The semi-rigid malleable rod is usually composed of plastic with a core of flexible wire. These rods can be bent down to conceal the penis under clothing or raised to form an artificial erection. The inflatable implant is more complex and involves several working parts: a reservoir of fluid that is implanted into the abdomen, a pump system located in the scrotal sac near the testes, and two inflatable cylinders. In order to attain an erection, the scrotal pump must be squeezed repeatedly, propelling fluid into the penile cylinders. When an erection is no longer desired, a release valve is pressed on the side of the pump and the cylinders deflate. A woman has two ovaries, which are vital in the role of reproduction. The ovaries are attached to either side of the uterus and are responsible for producing eggs and sex hormones, including estrogens and progestins. Sometimes it is necessary to surgically remove one or both ovaries because of particular medical conditions. This procedure is called an ovariectomy or oophorectomy. Some reasons for the removal of one or both ovaries include an ectopic pregnancy, endometriosis, cysts or benign or malignant tumors, and pelvic inflammatory disease. Removal of the ovaries may also be recommended as part of a hysterectomy. A woman can still become pregnant with just one remaining healthy ovary. Menopause, commonly known as the change of life, is a natural event in a woman's aging process. It signals the end of a woman's menstrual period and her ability to reproduce. During a woman's reproductive years, hormones like estrogen and progesterone work in an ongoing cycle to prepare a woman's body for specific functions like menstruation, conception, and pregnancy. Menopause occurs when the repetitive release of hormones stops. Menopause can occur naturally, usually around the age of 50, or as a result of a hysterectomy. Symptoms of menopause include the absence of monthly periods, night sweats or hot flashes, and mood swings. Your healthcare professional may suggest hormone replacement therapy to replace the estrogen and progesterone your body is no longer producing. Pregnancy can occur when sperm joins a woman's egg in the fallopian tubes. An IUD or intrauterine device prevents pregnancy by interfering with the merger of the male sperm and the female egg. The IUD is a thin T-shaped metal device. It is inserted in a woman's uterus by a healthcare provider and is effective for up to 10 years. An IUD may not be appropriate for all women, especially those who have had recurrent pelvic infections, abnormal vaginal bleeding, or uterine cancer. It's important to remember that the IUD will not protect you from exposure to sexually transmitted diseases, including HIV. In an adult man, 500 million sperm are produced in the testicles each day. By contrast, his female partner only releases one egg every month. In order for fertilization to occur, the sperm must meet the single egg in the woman's oviduct or fallopian tube. Infertility can occur when a man has low or no functioning sperm count. Infertility can also occur when a woman is unable to ovulate, or has blocked oviducts, or has a disease known as endometriosis, where pieces of the uterine lining stray and adhere to reproductive organs. Treatment of infertility varies, but 80 to 90% of infertility cases are treated with drugs or surgery. Impotence is the inability to maintain an erection. An erection is dependent on blood flow to the penis, which is triggered by sensory and mental stimulation. Arterial blood travels to the tiny arteries inside the penis. The blood vessels in the penis dilate,
blood flow increases and vascular channels called the corpora cavernosa and the corpora spongiosum become engorged. At that point, an erection occurs and your blood is prevented from leaving. If there is any disturbance during the sequence of events, then impotence can occur. Certain diseases, including diabetes and muscular dystrophy, can cause impotence. Psychological factors can lead to impotence, or it can also be a side effect of some common medicines. A woman's reproductive system includes the uterus, the ovaries, fallopian tubes, and the vagina. The reproductive system is responsible for producing sex hormones and reproductive cells, and supporting a developing baby in the woman's uterus. Some women's reproductive organs will remain in their bodies for a lifetime, but for a variety of reasons, some women will have all or some of their reproductive organs removed. That procedure is called a hysterectomy. A hysterectomy may be an appropriate treatment for women who have cancer of the uterus, cervix, or ovaries, who have uncontrolled vaginal bleeding, uterine fibroids, or endometriosis. Herpes or herpes simplex is a viral infection that causes sores that usually appear on the face, or in the genital area, called genital herpes. A herpes simplex infection on the face usually results in cold sores that look like blisters and eventually crust over in a scab and appear on the mouth. Genital herpes also produces sores that can appear on the penis, scrotum, labia, vagina, upper thigh, buttocks, or around the anus. These symptoms can range from mild to severe. In fact, some people have symptoms so mild they don't even realize they have it. In other words, there are times when you may not experience outward symptoms of the virus, but it remains active in your body. The virus can be reactivated by stress or illness. Herpes can be spread through skin-to-skin contact while the virus is in its active stage. Antiviral drugs can be prescribed to reduce herpes outbreaks. Pregnant women should avoid exposure to herpes. Herpes can be transmitted to infants during delivery if the baby comes into direct contact with the virus. Herpes or herpes. Pregnancy and delivery involve the entire female reproductive system, including the ovaries, fallopian tubes, uterus, and vagina. After an egg is released from an ovary and is fertilized, it travels slowly through the fallopian tube to the uterus. During this time, it begins to divide until it has grown to about 100 cells. The egg, now called a blastocyst, then implants in the tissue lining the wall of the uterus. The uterus will then house and protect the developing fetus for 38 weeks, or approximately 9 months. When the fetus has matured and birth is imminent, the baby begins to go through a series of movements that help it navigate through the birth canal. As the uterus begins to contract with the pains of labor, the opening of the uterus, called the cervix, dilates to allow the baby to pass into the vagina. This muscular tube expands to accommodate the baby's head and shoulders, while uterine contractions continue until the baby enters the world in what is in most cases a downward-facing position. At this point, the baby will be cleaned and checked for good health before being placed on its mother's chest to rest and bond. Pregnancy and delivery. During pregnancy, a woman's uterus houses and protects a developing fetus. After approximately 9 months or 38 weeks, the fetus reaches full term and is ready to be born. At the time of delivery, the opening to the uterus, called the cervix, dilates to allow the baby to pass from the uterus into the vagina. This muscular tube expands to accommodate the head and shoulders of the baby, while uterine contractions continue to push the baby outward. Occasionally, the canal is too narrow to allow the baby to be born without tearing the vagina. When this risk is present, a procedure called an episiotomy may be performed. During an episiotomy, a doctor makes an incision in an area near the vagina and anus
in order to expand the opening and make more room for the baby as it exits its mother's body. Following delivery, the incision is then stitched closed for healing. However, this procedure lengthens the time of the mother's recovery. Before delivering her child, a pregnant woman may elect to have an injection called an epidural to numb her lower body. First, a fetal monitor will be placed on her belly in order to keep an eye on the baby's condition during the procedure. Then, the expectant woman will be asked to lie on her side and bring her knees upward towards her belly. However, this procedure is occasionally performed with the woman sitting up with her back rounded. Once she is in position, a doctor locates the appropriate section of her spine, cleans the area, and injects a small amount of local anesthetic to numb the skin at the injection site. Regardless of her position, the mother must remain very still while the doctor slowly and carefully inserts a long needle into her lower spinal column. The needle passes through her skin and between her vertebrae until it reaches the space just outside the membrane that surrounds her spinal nerves. This membrane is called the dura, hence the name epidural. Once the needle is in position, the doctor will pull back on the syringe to ensure that the needle did not pass into the dura or a blood vessel. If no blood or spinal fluid is detected, the syringe is detached and a thin catheter is threaded through the needle and into the epidural space. Anesthetic medication is then administered through this catheter, which numbs the lower portions of the woman's body, reducing the discomfort of childbirth. Endometriosis occurs in a woman's body. The uterus is made of 3 layers: the perimetrium, the outer layer, the myometrium, the muscle or middle layer, and the endometrium, the inner layer. Each month during a menstrual cycle, the endometrium grows to its full thickness. When it reaches its full thickness, one of your 2 ovaries ovulates. If the egg is fertilized, it will attach to the thickened endometrium. If the egg is not fertilized, the endometrial layer is sloughed off as part of your menstrual cycle. Endometriosis is a condition where some of the endometrial cells, which should be inside of the uterus, make their way outside the uterus, attaching themselves to surrounding tissues like the fallopian tube, the ovary, or the large or small intestines. So when your monthly menstrual cycle occurs and the endometrial layer is growing, the cells that strayed outside of the uterus are growing at the same time. When ovulation occurs and the egg is not fertilized, the endometrial layer sloughs off and other locations outside the uterus slough off as well. Bleeding occurs not only from the vaginal canal, but from other parts of the body, which can cause pain and cramping. Pregnancy and delivery involve the entire female reproductive system, including the ovaries, fallopian tubes, uterus, and vagina. After an egg is released from an ovary and is fertilized, it travels slowly through the fallopian tube to the uterus. During this time, it begins to divide until it has grown to about 100 cells. The egg, now called a blastocyst, then implants in the tissue lining the wall of the uterus. The uterus will then house and protect the developing fetus for 38 weeks, or approximately 9 months. When the fetus has matured and birth is imminent, the baby begins to go through a series of movements that help it navigate through the birth canal. As the uterus begins to contract with the pains of labor, the opening of the uterus, called the cervix, dilates to allow the baby to pass into the vagina. This muscular tube expands to accommodate the baby's head and shoulders, while uterine contractions continue until the baby enters the world in what is in most cases a downward-facing position. At this point, the baby will be cleaned and checked for good health before being placed on its mother's chest to rest and bond. Not every mother undergoes a traditional vaginal delivery with the birth of her child. Under conditions of serious fetal or maternal distress, or in the case of breech presentation, when a baby is turned feet first at the time of delivery, an emergency procedure called a cesarean section may be performed. During a cesarean, a doctor will make a lateral incision in the skin just above the pubic hairline or a vertical incision below the navel. As the incision is made, vessels are cauterized to slow bleeding. After cutting through the skin, fat, and muscle of the abdomen, the membrane that covers the internal organs is opened, exposing the bladder and the uterus. At this point, the physician will generally insert his or her hands into the abdomen in order to determine the position of the baby and the placenta. Then, another short incision is made into the uterus, and a nurse suctions any remaining fluid and enlarges the incision with her fingers. The baby's head is then grasped and gently pulled with the rest of the body from the mother's uterus. Finally, the abdominal layers are sewn together in the reverse order, and the mother is allowed to recover for approximately 3 to 5 days in the hospital. She will also be quite sore and restricted from activity for the following 2 to 3 weeks.